Hello everyone. I am Dr. Gaurav Bansal, Neurosurgeon, Director and Head of Neurosurgery at Max Hospital, Vaishali, Ghaziabad. Today, we'll be talking about why neck pain is increasing in the young population. As we all know, as of now, our work routine has changed dramatically over the last 10 years. Young people have started working on long hours on laptop, computers. They go to the office in the morning and come back in the evening, and then they come back to me that we are having neck pain. Sometimes it is radiating to the arms, sometimes they are having vertigo. There are n number of different problems come up with. So we'd like to see what kind of neck pain. They need to consult a neurosurgeon, or they can consult a physiotherapist, or they can do home remedies. So first of all, every neck pain is not cervical spondylosis. We are very worried about that. I think having cervical spondylosis. In some cases, they are right, but not in most of the cases. In most of the cases, the pain is simply due to muscle spasm. The muscles has got weakened, or the muscles are fatigued. What does that mean? They are having long hours of sitting. They stare continuously in the screen, and at the end of the day, they feel that their neck muscles have become stiff. They are having painful neck movements. In those cases, when they come to me, I simply diagnose them with few questions in my OPD, and in most of the cases, they are simply having muscle spasm. I prescribe them anti-inflammatories, muscle relaxants, and some physical therapies with which they can do at home, and they get all right in no time. But in some cases, they present to me with additional symptoms, like they are having pain radiating to any of the arms, they are feeling numbness or tingling in the arms or hands, or in some extreme cases, they are not able to handle or grip the objects. Those are the cases which are alarming, where we need to get additional tests like X-ray of the cervical spine or MRI of the cervical spine, or both sometimes, so that we get to know what is the problem in the cervical spine. In those cases where we are getting the imaging done, we then, after getting the imaging, we go through that in those images and see whether they are having disc prolapse, and if yes, then what kind of disc prolapse is there. If the disc prolapse is minimal, so again we would go for conservative treatment. What does that mean is medical treatment along with some physiotherapy. But if the disc fragment is impinging or compressing the nerves or spinal cord, then it would need surgical therapy, because if the blood supply to the nerves is getting compromised, if the nerves are compressed, and patient is having some symptoms, motor symptoms, which we say that he is not able to grip on the objects, or he is having difficulty lifting the arm, or he is having continuous sensation in the arm with tingling sensation. So in those cases, and when radiological images also show that the symptoms are concurrent with the radiological finding, then we advise surgery in those cases. But these are just 10% of the population which come to me for the neck pain, in which we advise surgery. In other cases, they usually go with the medical treatment. In these surgical subset of the patients where we say that surgery is needed, even though surgery is straightforward, patient comes to us, gets admitted, we perform surgery, and very next day they can walk home. There is no bed rest whatsoever. So surgery is safe and doable, and is being routinely done at our center. A lot of patients has benefited from medical as well as surgical treatment, and there is no need to panic, because if a doctor has said that surgery need to be done and people got panic. So this is not something which they should be panicked about, because this is perfect science, and patients do get better after medical or surgical management. So in the end, I would just like to emphasize that there is treatment available for the cervical pain or the neck pain, even if it's a medical treatment or a surgical treatment, and people need not be afraid. But there is a need for them to come to a neurosurgeon and get the proper evaluation done, so that we are not looking at long-term weakness in the arm or complications which cannot be reversed later on once time is gone. So I would like to say thanks for listening to me and watching me. And if there is any problems this which we have explained in this video, you can contact on the given phone numbers below, and my team would get in touch with you. Thank you.